Greetings, everyone. This lecture focuses on clinical assessment of children and adolescents. The module we're going to talk about will focus on assessment techniques with child and adolescent populations. Environmental interactions are crucial in schools, neighborhoods, homes, and with peers. So conducting a comprehensive childhood assessment involves considering various factors like age, development, health, culture, race, gender, socioeconomic status, family background, personality, and intellectual capacities. Clinical assessment differs from diagnosis and testing, and it relies on diagnostic systems like DSM-5 or ICD-10. Assessment is a problem-solving process that helps clinicians develop interventions and treatment plans. In this module, we will address these aspects of assessment and also explore diverse diagnostic methods and multicultural issues in child assessment. We will explore child diagnosis from three perspectives: categorical, dimensional, empirical, and behavioral. The categorical approach, exemplified by the DSM-5, aims to definitely identify diagnosis using established criteria, now incorporating a dimensional approach for greater precision. On the global stage, the ICD-10, developed by the World Health Organization, has been the most commonly used classification system. The ICD-10 coding system has been adapted for the United States. It offers expanded injury codes and a great specificity in code assignment. Empirical diagnosis employs multivariate classification, providing a holistic evaluation of children across various dimensions. However, it relies heavily on reports, which may not always be cross-verified. Behavioral diagnosis emphasizes functional behavior analysis, pinpointing specific problematic behaviors, triggers, and tailored modifications. This approach is highly personalized, but lacks a classification system and may overlook historical factors such as when the illness has started. Psychological theories guide our choice of assessment tools. They may give us an idea about potential reasons why the child is struggling. A comprehensive assessment combines these three diagnostic methods: categorical, dimensional, empirical, and behavioral, to gain a comprehensive understanding of a child's challenges and strengths. Exploring psychological issues is an important part of a complete childhood assessment. Psychological issues can be examined using neuroscience, psychological, cognitive, affective, and learning theories. Recent progress in neuroscience is shedding light on the biochemistry, morphology, and genetics of mental disorders across the lifespan, offering promise for targeted prevention and treatment. Genomic studies have identified protective alleles that shield some children from mental disorders, informing early interventions. Family history assessment remains crucial in clinical assessment. Continuum theories suggest genetic commonalities among conditions like depression, bipolar disorder, and ADHD. Neuroscience has debunked certain potential parental behaviors as causal factors for disorders like autism or ADHD, revealing shared genetic predisposition. Environmental risks validated by brain development research highlight prenatal and neonatal targets for prevention, such as improving the quality of maternal nutrition and reducing maternal stress and trauma. Major depression's neurobiology remains consistent across the lifespan with genetic and environmental factors at play. Thanks to the brain imaging studies, we know that effective interventions often combine psychotherapy and medication. Identification of biomarkers holds promise for more precise and effective mental health treatments in the future. Psychological theories of child development offer diverse perspectives. Barth suggests that children's problems may be temporary as they often outgrow them, while stage theories like Piaget's and Erikson's suggest fixed developmental stages. Contemporary theories highlight flexibility, emphasizing that children develop at various rates, suggesting that all children can learn and change. Major child developmental theories fall into cognitive, affective, or learning categories. Cognitive theories by Kohlberg and Piaget focus on mental processes' role in perceiving and influencing experiences. Piaget outlined 4 stages: sensory motor, pre-operational, concrete operations, and formal operations. Kohlberg described 3 levels of moral development, each with 2 stages. Affective theories influenced by Freud and Erikson explore the role of emotions in development. Freud's work includes dimensions like dynamic, generic, topographical, structural, and economic aspects. Erikson introduced psychosocial developmental issues in 8 stages. Learning theories, including classical conditioning by Pavlov, operant conditioning by Skinner, and social learning theory by Bandura, emphasize behavior learning through rewards, punishments, and observational learning. Learning theories are the ones that have received a significant amount of empirical support for their concepts. Child problems, argue some researchers, are not solely a product of individual issues, but rather a reflection of a larger ecosystem in disarray. To create lasting positive changes, it's essential to assess and address these problems within the broader context of family and environment. Familial theories highlight how family stress and developmental changes in children can lead to maladjustment. For example, isolated families in rural settings often lack resources, which can add a lot of stress to both parents and children. Issues like domestic violence, child abuse, and neglect can profoundly impact a child's emotional and cognitive development. Family changes, such as divorce or remarriage, can be stressful too. Also, parental factors such as unemployment and psychopathology can play a significant role. Environmental theories emphasize the importance of external relationships and settings like home and school. Children's behavior is influenced by their personalities and environments, which may vary between these settings. Social, cognitive, and self-management competencies are key for a child's success. Family and environmental factors can either encourage or hinder normal development of the child. At the same time, the child's motivation can significantly influence whether or not that child would be able to successfully use the resources available in the environment. Culture is another important factor that plays a significant role in shaping both a child's environment and child's experiences. Assessing children of color in a comprehensive manner requires considering their development within Erickson's stages and ecological systems, with cultural competence and critical race theory as essential frameworks. Critical race theory highlights the significance of institutionalized racism and challenges the limitations of a colorblind cultural competence model. Psychosocial adjustment, including cultural variations in affect, self-esteem, and coping mechanisms, must be carefully evaluated, especially for immigrant children. Family dynamics influenced by ethnicity, social class, religion, and traditions play a crucial role in a child's life and should be explored as well. Additionally, school adjustment, peer relationships, and community adaptation influenced by cultural norms and expectations should be assessed to understand the child's well-being in their unique cultural context. Let's discuss various assessment tools that can be used with children. First of all, social workers need to utilize relevant research to inform assessment. Published research can often help in estimating problem rates, identifying risk factors, and validating assessment tools. Practitioners must review literature to choose appropriate tools with evidence of effectiveness. Various techniques can be used for assessment, including global techniques like eco-maps and genograms to understand the overall functioning, and self-report instruments to measure specific issues like depression using cognitive, affective, or behavioral criteria. In the process of assessing children, various techniques play a pivotal role in gaining comprehensive insights into their well-being. Interviews are among the most effective qualitative assessment tools. They provide a platform to establish rapport and collect information from different perspectives, including the child, parents, and teachers. Structured and semi-structured interviews offer flexibility in tailoring questions to the child's age and personality. Parent interviews, for instance, aid in understanding family dynamics and the child's problems within that context. As for play-based assessments, these are particularly valuable when dealing with younger children. Activities like drawing or modeling can reveal their emotions and concerns indirectly. Structured therapy games can be engaging and informative too. When evaluating play, factors like energy, creativity, age appropriateness, and tone are considered. Children's play often mirrors their family dynamics and may provide insights into any family-related issues. In cases involving older children, sculpting and other family techniques can be used. Sculpting involves molding clay family members can do, and that will allow to depict scenarios, and it will facilitate discussions about feelings and family dynamics. Eco-mapping, on the other hand, visualizes the family within the larger community context, identifying external influences. These techniques encourage collaboration and provide opportunities for change within the family unit. The self-report techniques and scales offer a unique window into a child's world, allowing them to share information about themselves and their concerns. These techniques may include the use of standardized instruments, self-anchored and other rating scales, and self-observation methods, all designed to gather comprehensive insights into the child's well-being. Standardized instruments such as the Depression Self-Rating Scale and the Children's Depression Inventory are tailored to measure specific aspects like depression, self-esteem, and interpersonal relationships. These tools often have companion scales for parents and teachers, which helps to get a more holistic view of the child's situation. Self-anchored scales provide a more personalized approach, letting children rate the intensity of their issues based on their own experiences. These scales often involve creating anchors that are unique to the child, offering a nuanced perspective. Self-observation techniques empower children to monitor their own behavior and concerns, utilizing tools like problem checklists and data collection methods, such as recording information on a special card. In children assessment, the input from parents, teachers, and other professionals plays a major role in understanding a child's behavioral and emotional landscape. These perspectives are often obtained through standardized instruments and direct observation methods. The Achenbach Child Behavior Checklist is a widely used instrument that provides valuable insights into children's behavior. It has proven to be effective in identifying impairments and their severity. Functional behavioral assessments conducted in schools are used to understand the antecedents and consequences of specific behaviors. They employ methods such as behavior observation and recording. These techniques aim to answer critical questions about the behavior's nature, triggers, and outcomes. Social workers and teachers can also use direct observation and recording of children's behavior. They can make narrative recording of events such as getting out of the seat. Interval recording is when a direct observation is performed over equal intervals. Frequency recording helps document how often a certain behavior happens, while duration recording helps with measuring the length of that behavior. Standardized tests in child assessment measure intelligence, achievement, and specific issues. Social workers refer children to trained professionals for comprehensive evaluations to match children with appropriate programs and special resources.